Welcome everyone. Good evening, ladies and gentlemen, dear guests, to our 26th Salon of Pioneers. My name is Valerie Streibel and I'm the co-managing director and head of corporate communications at FASresearch. So FASresearch is hosting this format for over 10 years now. Our intention behind this format was that in a world where there's a huge need of innovation and change, you need to talk about how the new comes into the world with those who are actually paving the way, the pioneers and the change makers, and to learn from their insights and experiences. So as you saw in the invitation, today is World Heart Day. Cardiovascular disease is still by far the #1 cause of death worldwide and here in Europe. So there is a strong need for scientific pioneering and providing access to innovative drugs to save lives. Not at least because of recent developments, the inflammatory effect that COVID and long COVID have on the blood vessels. So we are very happy tonight to have Claus RUNGE with us. Since February 2018, Claus is leading the Global Market Access Group, and as of July 1st, 2019, he is leading the Market Access, Public Affairs and Sustainability at Bayer AG Pharmaceuticals. Claus has over 21 years of experience in working in the pharmaceutical industry. He has held senior roles on both local and global level in various multinational companies, such as GlaxoSmithKline and AstraZeneca. And Claus is a pharmacist and health economist by training and holds a PhD from the Humboldt University in Berlin. He served as one of the editors of the European Journal of Health Economics from 2006 to 2018. And he's helping to become a renowned journal in the field. And he has published numerous articles in high impact journals with a focus on health economics and quality of life research. So Claus, thank you again for joining us tonight, for being our guest tonight. Harald KATZMAIR, founder and director of FASresearch, is a leading expert in the field of applied social network analysis, and he will lead the conversation with you, Claus, today. So I wish you all an interesting evening with Claus and Harald, and I'm handing over to you now. Thank you.
Thank you so much, Valerie. Yeah, hello everyone who's like part of this channel here. Yeah, as Valerie has mentioned, today is the World Heart Day. The heart is a very important and also a very emotional part of our body, and but I don't want to. We don't want to talk too much today about health and how to stay healthy. That's not our task here today, but we really would like to use the context of the World Heart Day for a conversation on the global state of innovation and progress in life sciences and in medicine, because I think that our cardiovascular is a very great example how innovation works in medicine. And I also believe that there's still a lot of work to do to raise awareness in the public, how complex and global this process actually is. So this is something we want to touch today, but also would like to cover the topic of the role of Europe as one of the epicenters of innovation in this field, our role of Europe, also in relationship to the US and to China. And also we want to learn from Claus how the global European corporation Aspire is able to navigate the complexities of a world that, and we see it every day, becomes more and more fractured and polarized. And last but not least, I would like to cover in our conversation what we can do here in Europe to prevail and also to transform all the capacities that we actually have here, and we will learn more about in our conversation. How can we transform it and build a real resilient and connected European ecology? And that this is important. I guess we all have seen with COVID that the life sciences and the healthcare system is just not one sector among others, but it's more like a part of the lifeline infrastructure So the rest of the economy and the society relies on it. Yeah, Claus, I couldn't be happier to have in this conversation today somebody who is in his professional role at Bayer fully involved and also, I guess, exposed to those deep and complex questions. They're not easy. We all know that. And we hope that you can give us some firsthand experiences, also some guidance on how to operate in this context as a European organization. You're managing a global business, and it's all about managing global access to innovative therapeutics. And this in the world, and I think this is a metaphor for our world that suffers more and more from cardiac arrhythmias. So, Claus, may I start our conversation with the question on the innovation activities of Bayer in the field of cardio. We know from a research project, a network study that we conducted on behalf of your department, that Bayer is actually leading globally in terms of the number of patents in cardio over the last 20 years. There's no other organization as active in terms of patenting. You're also very active in science, publications, clinical trials. But this is really like our patents are a very, very visible manifestation of how active you are. And I think our audience is interested in learning more about what Bayer is actually doing in this field, where your focus are. And also, I mean, cardio is a kind of established field, and it is, as we've learned, by far the #1 cause of death are all around the world and in Europe. So what are you pioneering in this field, and maybe are there any breakthroughs that we can expect are in this field from your work at Bayer?
Well, first of all, thank you, Valerie and Harald, for setting up today's discussion, and pleasure to be here in this format. First and foremost, I have to say, also in the context of the World Heart Day, that probably heart disease is not broadly perceived as being one of the most prominent and most burdensome diseases on this globe, right? If you see the notion in the public, let's say more also in the lay public, you have a sense that many of the issues may already have been fixed. Yeah, so you have treatments to treat hypertension, you have anti-clotting agents for many decades actually, but we all probably have members of family or friends who suffer from heart disease, and there still are huge challenges in the treatment of some specific forms of heart disease, and I come to that in a second. The burden is truly huge, both for families, caregivers, but also to our healthcare systems. They are actually connected with a high level of cost and expenditures that every system needs to invest to treat patients with heart disease. And it also has an impact on the workforce, because many people are not as active as they used to be, or they drop out of being employed because of their disease status. Now, but Bayer probably undisputedly is amongst the world leaders in cardiovascular or cardiorenal as a company in the pharmaceutical industry, and we have I would say some of the top experts in-house and some of the top research teams in-house who do excellent work and who try to develop the next range of potential treatments for specific heart diseases. So, I mean, and it's a long way from aspirin, the kind of wonder drug for more than 100 years to today's treatments. Just to mention a few milestones in between, a couple of decades ago, we've started investigating novel oral anticoagulants, so-called NOACs, and we've also brought one to patients and to the markets, and it's proven to be extremely successful globally. The whole class that had opened up by the time is really one of the cornerstones when it comes to stopping blood from clotting, and they're actually easier to use than previously applied medications who required actually very close routine monitoring. But there are areas that are really underserved, and the one area that is on top of my mind would be an area which is called heart failure. It can develop silently over the course of several years and can be especially a challenge to societies with societies aging, but it can also develop in patients who have survived a heart attack, and there we really have a high unmet need. Just to give you a number and an idea, patients who receive the diagnosis have a 50% chance of passing away within 5 years of diagnosis. It shows you how consuming this disease is and how life-threatening. So also in this field, we have new developments. We have just recently launched a product in some markets, starting in the US, that treat heart failure patients, specific forms of heart failure. There's one product that we have launched together with our partner Merck in the US, and as Bayer alone in other legacies. But first and foremost, also in the context of today's discussion, these projects can only work out with close collaboration of multiple partners, be it academia, research institutions, other companies, those who develop new technologies. I think more than ever, collaboration is key to get to tangible progress, and you see it also in the activities that major pharma players like us are putting behind networking efforts and acquisition efforts. And oftentimes, like with Bayer, it's not full acquisitions that we do. We acquire companies and let them operate at arm's length in order not to hamper their innovative power and energy, and in order not to slow them down in their promising efforts. So the one thing, and just to finalize the perspective on World Heart Day, is that we as a company also have invested heavily into cell and gene therapy platforms. We have done some massive acquisitions over the past 18 months or 2 years, I would say, in Blue Rock, AskBio, just to name two of them. And there are emerging therapies, and these are emerging technologies who could someday also be applicable to patients with heart failure. And that's one of the indications we're looking at together with our friends in the newly acquired businesses. So, but as I said, collaboration is key these days.
Well, I guess what's really the impressive thing about the company's Spire is when you look at those collaboration networks, what you see is like you're active in all parts of the world, all continents. You have research collaborations in the United States, in China, all around the world. And what I'm curious, and I think there's people out there who also ask those questions, are, do you already sense, or do you already sense an impact of all those geopolitical rivalries that are emerging, because one of the things that we have heard a lot when we talked about COVID, we have to become more resilient and we need our own, and everybody's talking about like his own national perspective to protect interests, etc., etc. So a lot of things in the world are changing. Do you already feel it, or is this something like at the science level, people collaborate and let politicians talk? So what is your experience here?
Well, you rightfully mentioned that there's political tensions, especially if you look into the situation that the US and China are in these days. However, I think both the business community and the scientific community are eagerly interested in maintaining close relationships and exchange. Yeah? So just to give you an example from the business side, there is a forum called Bloomberg New Economy, which will also set up a meeting in Singapore in November, and we're a founding partner of this initiative, where business is trying to bring the East and the West closer together despite the geopolitical tensions, right? And I think the same is applicable to the science part and the science communities. You rightfully say that, I mean, we're headquartered in Germany, in the EU, but our business is global. Yeah, so I haven't got the latest share of sales and revenue on the top of my mind, but I think we have a roughly 40% source of business in Europe, and the rest is global. So the majority is actually outside the continent where we're headquartered. So, and of course, also our interest is that we have a functioning global network of exchange of ideas, of intelligence, of talent, and that is something we actually want to foster in what we do. I think when we talk about Europe, the role of the life sciences industry and big pharma for network connectivity is actually crucial, because especially if you look into cardiovascular disease, the amount and the quality of clinical trials being conducted in Europe is outstanding. And actually, we as a company are one of the key sponsors and key coordinators in the European network, but even beyond. We collaborate actually with the top 100 most respected cardiovascular and most scientifically productive institutions in the world. So we also as a company can play a significant role in knitting together the various continents above and beyond those political tensions. The one thing I would desire for Europe to come into play would be more of a uniform data sphere, better conversions of health data, a better access of researchers, including industry, to these data pools, at, of course, relevant data protection rules and sufficient data protection rules.
We can talk about what could be improved or changed in Europe later. So what I'm hearing here, and this is like, I think, a kind of good news, one of the few good news that we hear these days, and I can confirm it. We did also like this network studies on the COVID cooperations, and the stunning thing was like that, for example, the axis between the United States and China at the science level was never interrupted through all this kind of geopolitical upheavals and conflicts. They just did their stuff together and exchanged genetic data and collaborated, which is I guess, and also you say, well, there's like a strong interest in the global business community to uphold those networks, because maybe you can, because when I share this with friends who are not like knowledgeable about the pharma world, it's not a lot of countries who actually have also the resources to drive our the scientific progress in medicine. So it is like a totally globalized network, but just like among like 12 up to 14 key countries, and Europe is super important in this regard, and I think we are not aware of how important the contribution of like Germany or is here in this field. Mm-hmm. So what is your perspective in this regard on how much public understands about how this works, so and what we could contribute that we raise awareness of how this kind of globalized network works? So I'm mentioning it because if you look at it, there is no way to renationalize or even re-Europeanize those networks. It would be just like it's not a solution.
Yeah, I would draw a parallel to supply chains and who are also interconnected to start with, and then try to build the bridge to scientific exchange and collaboration. So I've seen that as a reflex during the pandemic, some countries have called for the re-verticalization of supply chains, for example. I think this is the wrong way, right? Because it means you are creating inefficiencies. I think the pharmaceutical industry has proven that vastly the global supply chains, although they have been put under significant stress, could be upheld and secured even during the pandemic. So we didn't have any shortage in product supply, for example, from our end as a company, and we're pretty proud that we stood this stress test. Reverticalization would mean that you invest money into doubling up on supply chains, and you would miss. You can only spend every euro once. You couldn't invest this euro that you spent there in innovation, and that would be a pity. So I think resilience in healthcare systems can only work if we continue to embrace global partnerships and make sure that even under stress they don't collapse. Yeah, so that's one. And I think that is something when we talk about resilience, which is also true for the exchange of science. Yeah, I also have to say that if I look into the global trials that we are running, they continue to be live and active even during the pandemic, despite them being on various continents. So that should give us some hope that a global collaboration can prevail.
Well, there is global collaboration, but I think, I mean, this is experience from everyone who works in the field, and there's also evidence from studies and also from network studies that when you look at the contribution, for example, of Europe in terms of scientific output, the market share of Europe, if you add up all like European countries, all 28 or countries, or including Switzerland, etc. So if you sum them up, you have a much higher output in market share compared to the United States. So this is like a very impressive performance of Europe. You have this in cardio, you have this also like in oncology. So but when you look structurally at like who controls the flow of information and who is like, there's like a huge asymmetry, because the status you gain still when you're a researcher and you're collaborating with one of those important organizations in the United States. So status and capital still is theirs. That's like, you also see like when you look at the citations, so the citation market share of the United States publications are much higher than the actual number of publications they produce. So there's a status asymmetry, so to speak, and so the ideal collaboration would be like a brain circulation, right? Not a suck up, not a brain drain, not that our best researchers move to the United States, but that we have like a circular model. But we're not quite there yet. So what is what do you think could be done? And you're as their leading continental life science company in this field of cardio. So what do you think could be done to strengthen this European stratosphere so that we really become like more part of a circular model and not like of a brain model?
Perhaps I don't want to add too much complexity, but given what you've just said, I would also like to add that with Brexit, the European network performance has also been reduced. Yeah. So if you look into the intensity and the productivity of global networks between Europe, US, and China, Great Britain has played a major role in many areas of science, also medical science, as a gatekeeper and a connector of transatlantic science. Yeah. So and with Great Britain leaving, I think the European Union would be well advised to get a head around of what to do to compensate for that loss of connectivity within the Union. So there are risks to mitigate, and I think the European Commission should start designing post-Brexit strategies for a specific area of science. So that's just to add to what you've said. And coming back to your question, I think we need to make sure that our key economic relationships are not being negatively effective, such as free trade agreements and bilateral negotiations. And I think the EU-US relationship is of particular importance as we work to advance, for example, the Transatlantic Tech Council. You could also think about a stronger coordination on health policy between the US and Europe, including a clarification of a common regulatory framework or a transatlantic health data exchange. And in addition, a stronger partnership between government and private corporations. Yeah? For us, as I said, we invest on both sides of the Atlantic. These are key markets, and I think the public needs to be aware that every attempt to de-globalize or re-regionalize is the wrong route to choose.
Yeah, I think this is a very strong and important message here, and that it's not that you can, if you want to rebuild or, as you said, or renationalize those networks, it would be just like it would completely kill progress in those areas. I mean, but here's one thing. I mean, what's very obvious when you look at those global networks of collaboration is that, and you talked about London and Britain as a very important gatekeeper, specifically in the science networks, that are, what you see is always like you have the strong links between the United States and China, but there is I don't know collaboration between European countries and China, but it's clearly like not as established as the link between US and China. So this is, and it's always like, and you look at it and you say, well, the US here really plays like a global broker and is in control of the flow, but they also hold and control the links to China. Why? Because also China Chinese scientists, they want to publish in those journals, those A-rated journals. So the stratosphere, again, is like an Anglo-Saxon stratosphere. And as long as this is the case, it's for the Chinese not really like as attractive to collaborate, et cetera, et cetera. So I would be interested and curious, because you also like operate in China, and this is like, again, this is a very, very sensitive balance, and that you're holding here. So what do you think could be done from a European perspective to strengthen those access to China, to become probably more like a broker and not just like a hanger-on to the US markets? Okay.
Well, I mean, of course, we have a very strong and long-standing presence in China, and we're actually doing significant investments in China, especially also with top-edge research centers. So, and hand in hand with this comes an exchange of scientists between, let's say, Europe, US, and China within our own network and company, but also above and beyond. I think you rightfully say China is on the rise. Europe is probably too dispersed to be seen as being a partner for Chinese scientists who is as strong as the US. So in return, this means that Europe should promote a more dense networking. So every effort to bring universities and centers of excellence together in Europe should be undertaken and promoted also by policymakers, and industry can rightfully, as you say, contribute to these stronger networks. I mean, if you just shed a light on the research that has gone into COVID-19, you alluded to the fact that despite the global hiccups is too nice of a word, but despite the global challenge, science exchange was still strong, and we also set up, let's say, meetings with Chinese scientists very early on when they started sharing their COVID-19 patient protocols that they had applied in university hospitals, and we shared that with researchers in the EU. But it's fair to say that we are very productive in Europe. I mean, 7 out of the top 10 countries in COVID-19 are actually European. Yeah, so if you look into Germany, the German Center of Cardiovascular Research and the Charité are leading in cardio-related COVID-19 research, especially in terms of absolute number of articles and publications. And again, there is a strong link between COVID-19 and cardiovascular disease, as we learn that there is an inflammation involved of blood vessels. And since we're a stronghold in cardiovascular research in Europe, be it in terms of clinical trial expertise, be it in terms of IP, be it in other ways in terms of scientific output, we can play a key role in Europe in finding the right answers to treating or preventing, so treating COVID-19 patients properly or preventing them from having long-term consequences such as you called long COVID. Yeah. So there we can play a significant role, and if research is outstandingly well, if it's really concentrated within Europe, I think the attractiveness also increases for collaborations with teams outside of Europe.
But who's got to take the lead on that? I mean, you described it so clearly. I mean, this is again a very strong message. He said, as long as we have don't show more coherence and alignment here in Europe, and we have this kind of dispersed networks that are in absolute numbers, it's massive, but we are not really capable to align it and to what's called like build critical mass. I mean, this is a stunning or astounding phenomenon, because we know this now for 40 years. I don't know. It's like this is not news, but we are not. There's no progress that I see. So, what would be like from an industry perspective, or from your experience, what would be like an ideal model of such a center of excellence, for example? So, how could it? Who should be the leading countries? Who should set the initiative? So it's like
I think you rightfully say that it feels like we need an ignition.
Yeah.
And I would really call also European policymakers to make bold steps in this field. Yeah, I mean, there's programs in the European Union, like in oncology, the Beat Cancer Plan. I mean, let's set up something similar in the cardiovascular field. Let's try to strengthen the translation of early findings, of early signs into products, which is probably a bit of an issue in Europe. At least it is in Germany. Translation of early research into applicable products and value capturing. We, especially under the light of Brexit, need to set incentives for networks to grow, for universities to connect even better, for academic exchange, so that we can flourish even more in this field. Perhaps a European Center of Excellence in cardiovascular research would be helpful. We have strong countries. I mean, the Netherlands, Denmark, and Germany are particularly strong in this area of cardiovascular disease. And France, by the way, is one of the leading countries worldwide in conducting clinical trials in this field. So you have very strong partners with the Netherlands and Denmark, and then, of course, Germany and France in the heart of Europe, who could drive national research programs. And let me drop the term EU Horizon. That could also be a vehicle to help funding industry ecosystems. And last but not least, I think above and beyond supporting university infrastructure better, we need the willingness to really embrace way more public-private partnerships. I think that has to some extent worked out quite well in the pandemic. If you look into some of the countermeasures, I think this has been a period of more openness from all players in the system to really come together and to connect. I think we need to preserve this and the trust that has been built up in the past, let's say, 18 months. As I said, finally, startups need to have a good environment for translation. Yeah? I think that is one of the key things where at some stage a lot of innovation goes across the Atlantic. I'm not saying that everything should be in Europe, don't get me wrong, yeah? But I think the world would benefit, and the research world also in this field would benefit from the world not becoming too bipolar.
Right.
Because we have so many good scientists also in Europe that have really strong, also from a global perspective, strong knowledge and strong innovative power. So I think a career path for a scientist usually goes via the US. Yeah. So we should work towards an environment where it could be either the US or European institutions. I think we have those institutions, but that's also something to put on the table here.
By the way, I guess like this circular model also would apply to, or as a basic structure for a center of excellence. It's all like think tanks are are designed, that you don't have their fixed staff. So of course there's some people who manage institutions, etc., but that you have like a home affiliations in Germany, in France, in Denmark, in Netherlands, as you said, the strongholds of, and they are like for several months or even weeks, or I don't know, would like collaborate there in the center of excellence, go back, so that you have like more like a circulation flow, and not again like a suck up, and then you have like phenomena like in Eastern Europe where a completely depopulation effect, so to speak, where people are leaving, and you would have a lot of resistance from the countries, rightfully probably, right? So because they see that their best researchers are leaving, and that's like, so this circular model, I guess, could also be like an important guiding principle for setting up a center of excellence. So this would have actually been a question here, but you already touched it, but maybe we can elaborate a little bit more on what we've learned from COVID in terms of what kind of things that changed in a positive way, or also what we've learned, what has not really worked. But let's stick with the positive. So what is it that you think we should continue to do, and also like is applicable to cardio, because it's a cultural thing, it's an infrastructure thing, and this guy, I think is a very important question to have, like this lessons learned from COVID.
Yeah. Oh, there's probably tons of lessons learned in terms of how to communicate quick and fast response to the threat by developing a vaccine, and how to communicate this to people, etc., etc. But what have we learned? I think, and I come back to that point, is collaboration and is key. Yeah. So we have seen that companies have reacted, and they have played their role in coping with the pandemic. I think the readiness to enter partnerships also with public institutions has increased significantly, and that is something worth being called out. Yeah. And I think also in some legacies we see that healthcare has been discovered as an area where it's not just about containing cost, but also investing for the future, and in investing in growth for the well-being of the economies and the societies. I think I hope that this perception and the willingness to make healthcare systems more resilient will actually survive, let's say, the discussions that we have, given the debt level that has accumulated in response in response to the pandemic. So I hope we don't lose sight of the fact that health is a true asset that needs to be protected. Yeah?
Yes.
So that's one. And secondly, and research in this field, innovation in this field, and progress in this field needs to be protected and really supported. That would be my hope. Yeah.
Well, Klaus, we are already like our 45 minutes in our conversation. So I would like to close here with a personal question that I'm really curious how you will answer it, because in your job portfolio, I mean, you're dealing with market access, public affairs, sustainability at the global scale. And this means that you have a lot of time zones. I don't know actually how many time zones there are. I don't know, 24 probably. No, I don't know. I have no idea. maybe you can tell us how many time zones we have in this planet. But anyway, so you're dealing with all those time zones, and the topics you're covering are really like hotspot topics. Also, like there's conflicts as always, there's friction as always when in those areas. So how do you deal with that? And I know that you also like have a family and kids, and or so how do you find time for yourself and for your family between those time zones?
Yeah, I think all of us had to adapt, right, to some extent, and the pandemic has had a significant impact on our daily lives. I think the answer to that is, first of all, personally, I think I've always been able to quickly adapt to new situations, and that probably is key. And there's a few things that help me doing that. And so during the pandemic, there is one thing I would say which helped me a lot, and probably also my nearest and dearest is I'm a foodie, and I've probably done a black belt in cooking in this period. Yeah. So I probably haven't left out any cuisine that I tested here in my kitchen. So, but I can tell you, after 1 year or 1.5 years, you're also desperate to go out for a dinner, which I now do whenever feasible. That's the second one, and there's another element of mindfulness and also thinking about your own health, right?
Yes.
So I have the pleasure of living next to a river here in Hamburg, next to the Elbe, and it's just 200 meters to the river line. And I'm a runner, and oftentimes I just take a run, yeah, to get into motion and to free up my mind. Actually, I've during the pandemic, I've built in 3 slots per week for a 10-kilometer run. So I try to, and I told my PA to really block them. And we always looked into when does it fit best, sometimes early in the morning, sometimes over lunchtime or in the afternoon. So that's something that helped me. And of course, the nearest and dearest family and friends who actually helped, we helped ourselves through the pandemic. With my kids, I've done things that I usually probably wouldn't have done. We built a soapbox car, for example, instead of going on a vacation. So that was a great experience that probably we wouldn't have had in the absence of a pandemic. It doesn't mean that I wish for another one, yeah, but it will probably mean that I reflect on my habits, and probably I will do a few things differently, also with my kids and other activities in the absence of a pandemic. Thank you for having me in this format. As I said initially, it was a pleasure discussing with you. And I hope it's a call for action for those who dialed in, and also for ourselves to really looking into strengthening the European ecosystem as part of a global network, not as a competition to a global network, but building on the strength we have in cardiovascular disease, huge clinical trial, high IP output, excellent science. We should be bold in the ambition, and then I think we can achieve a lot in this field.